I'd like to share you some important information about California's children's eye care crisis. Were you aware tens of thousands of children don't have the tools they will need to succeed at the COVID-caused online schools? Thousands more will wait over 2 months just to receive their prescribed glasses. This is just yet another unseen casualty, this loss of academic opportunity for thousands of online learners. This might be the biggest legacy from the FACES challenge in the year 2020. We received a memo and it said this from the Department of Healthcare Services. The coastal counties will now only be allowed to use PIA optical labs for fabrication of all optical lenses. This unifies the monopoly of a single provider for all the eyeglasses for the entire state of California under the nonprofit Prison Industrial Authority. Hi, my name is Doug Major. I'm an eye doctor in the coastal counties and had an opportunity to be an advocate for children for many years, particularly under the umbrella of slowlionseyes.org. Each year we screen with a professional exam all the children in our county, and with a sister program, all the preschool children. I'm also unique that I've been involved with corrections. I'm a certified correctional health professional, probably started the largest research for vision problems in the incarcerated population for juvenile delinquency, worked at Avenal State Prison, currently at the San Luis Jail, made presentations at the Correctional Education Association, the Academy, College of Optometry and Vision Development, received an award for 20 years of service with the Grizzly Youth Academy. So I wanted to tell you as a private practitioner what happened when this memo came and was activated. Immediate reduction of care for our children. My optical people were unhappy about the having to do more paperwork. We had an in-office lab. We had to lay off our local employees because they no longer had to do the work here. It was all sent to the prison. But the main thing is the tears and the concern from parents when they had children who, without glasses, were asked to do online learning. And this is not me alone. This affected the other doctors of the coastal counties. San Mateo County, by survey, the willing number of providers for glasses collapsed almost to 3, mostly community health centers who are required to keep those going. Willing providers were reduced dramatically. In San Luis Obispo and Santa Barbara County, SinCal Health leadership violently fought to this expansion, and they knew what would happen to their provider panel. After 6 months of self-funding, they also had to bow down and watch their provider panel, particularly in Santa Barbara and those in tribal areas, collapse. So what is this system? Here's some comments from the PIA laboratory as we beg for better service. Don't call us if your orders are over 8 weeks in our lab. They shouldn't complain. They're all getting their glasses for free. Don't send patients home expensive frames. They might be stolen here. This is from direct comments to our optical and to other opticals. Of interest, the Cal PIA optical allows no lens options, no special computer coatings as suggested by their school districts, no tints, thinner lenses, and no high powers, amazingly. Just the absolute basics, unlike any private optical or private insurance on the market. As a SinCal Health leader eloquently stated, the handling of this vision care crisis perpetuates the perception that Medi-Cal is poor access to poor service for poor people. So what is the Department of Healthcare Services? In this coming year in the budget, they will receive $126 billion for the care of the health care of our children and others in the state. In the year 2020, it was almost $1,800 billion. So how much is this used for these children? 0.000144% of their budget spent on our children's optical lenses, or 14 cents out of every $1,000 spent. Again, a very small part of their budget pie. And children being voiceless children are often given the least funding anyway, as this graph indicates, less than $2,000 per child. But who does benefit from this policy? Well, CalPERS billed the Department of Healthcare Services $17.5 million and resulted in $6.5 million in profit. So this was money that was transferred from local small business to fund the correctional industry complex. And no question, we're glad that the CalPERS has employees that can learn and grow with these inmates. And they had 117 participate this last year after requesting 180, meaning that they had a shortage of 63 optical workers. And this is due to the decrease in prison population. And of course, the main question, this must be saving the Department of Healthcare Services a lot of money, right? Well, maybe. It's very hard to get the actual numbers from the PIA, but to suggest that a PIA optical can compete with this very competitive eyewear market without being a forced sole provider is folly. And this is beyond just the coastal counties now. This expansion gradually increased over the whole state. And so as a whole state, we have lack of access to vision care. Here's an interesting comment by now Superintendent of Schools of LA Unified School District, Austin Buntner. If deeply rooted poverty and an unperforming public education system strikes you as intractable problems, think again. A simple yet powerful tool is needed. The tool, a pair of eyeglasses. Study by UCLA shows the impact on the vision to learn or how glasses can affect your ability to succeed in school. Obviously, lots of research in this area, and it's just overwhelming that glasses do help students succeed, and not only succeed, but in quality of life indicators. Let's talk about the type of vision care that's a problem with these Latinx children. It says visual impairment will increase 26% over the next few years, and most of those children will be multiracial, with Latinx children be the most largest demographic in terms of absolute numbers. 44% need these glasses. And this is the unique thing. The vast majority of these glasses dispensed is for a condition called hyperopic astigmatism. A lot of people think of glasses as just not being able to see the board, but children with hyperopic astigmatism have the highest risk of learning disorders and poor academic outcomes. So nearsighted kids, we could just have them sit closer to the board. Interesting enough, if you have nearsightedness, you almost have a greater possibility of doing well and going into higher education. On the contrary, farsighted with astigmatism is present before kindergarten. It interferes with how easily the eyes focus with horizontal and vertical lines. This makes it more difficult to learn letters, comfortably see the print during that very important early stage of reading readiness. As a result, hyperopic astigmatism is shown the most detrimental for academic performance and is the most prevalent disorder with the Latinx and Native American children. So intervention to this group is most important, and it is an issue of color. Here's an interesting outreach from the Vision to Learn nonprofit, presented in December 10th, 2019. Proudly says 51 children at the Oak Park Elementary School are delighted when the San Diego Padres helped them try on their brand new glasses. Were bought with a nonprofit provider. It's an estimated of 54,000 children in San Diego County that go to school every day without the glasses they need. These are Title I schools, meaning these are children that are under the Department of Healthcare Services responsibility. And it's great to celebrate 51 pairs of glasses, but 51 pairs out of 54,000 children in need? Is there some possibility of a policy failure here? And people don't realize Medi-Cal provides coverage for nearly half the children now in the state of California. They've taken on the responsibility to give care for over half the children in the state of California. And when you think that in San Diego County, perhaps over 50,000 children enter without the glasses they need, and now we have to have nonprofits fill the gap. And unlike what most people think, this coverage isn't free. When a working family of four is making just under $70,000 a year, they apply for the healthcare insurance on the exchange, the California Covered Care. Their children are assigned to Medicare or Medi-Cal. So they pay for that coverage, and they're promised eye care for their children. So how does the Department of Healthcare Services and CalPERS PIA respond? Well, this has been going on for now almost a year. And after these calls and concerns, and instead of just quickly allowing the local providers to use their existing sourced material and immediately fix this problem for our children, CalPERS has taken more time to contract these services out to another 7 labs, backup labs. This demonstrates clearly this is not an issue of money or good patient care. This is an issue of control in Sacramento. So let's have some calls for action. Governor Newsom, honor your promise to increase the access to medical and visual care for all the children in the Golden State, particularly since we're responsible for 50%. Department of Healthcare Services, reevaluate this 40-year solo provider relationship with Cal PIA. Let's update your vision delivery system to maintain your existing panel doctors and re-entrance the thousands or hundreds and perhaps thousands of providers that have left the program by incentivizing the vision care program for the children of our great state. And for the PIA leadership, stop your direct competition with local small business providers of vision care. Reevaluate the mandate that you have had as prescribed by law in Penal Code 2808I, and constrict your optical footprint as the prison population constricts. You know, when you see something that's not right, not just, not fair, you have a moral obligation to say something, to do something. John Lewis. From our new vice president, you can judge a society by the way it treats its children. One of the greatest expressions of love that a society can give its children is educating those with the resources they need. The glasses are probably the most easy and high leverage resource we have. Let's do the right thing for our children. Let's not only make it accessible to obtain glasses they need for school, but easy. It should boast the easiest, cost-effective, highest leverage way of helping our children have chances to reach their full potential. As the research at USC says, this research is a bellwether that visual impairment in young children can be prevented or treated with low-cost solutions if we intervene at an early age. If we don't, the long-term effect of impaired vision at early childhood can adversely impact academic and social achievements, will put our future generations at a distinct disadvantage. This is a population health transformational imperative. I would suggest that we use this opportunity to make it a better future for these children. This is my personal feelings and not directly associated with any group, but further information can be obtained by going to the California Optometric Association or Vision to Learn. Thank you for your time.